My name is Chris. This is, of course, G Medical CPR. And just let's give it up to Liberty Baptist Church for coming out, you know. Right? And of course, we got to give the glory to God, right? You know.
Yeah.
You know, we're a round of applause for that. Okay. So we're thankful to have this opportunity to teach you today. Once again, I'm Chris, and you know, we have Brother Shay doing our assistant instructor role, and let's give a round of applause for him. You know, we're just thankful. You know, so we're gonna be doing a quick recap over the first aid portion, and then we're gonna go over a few things dealing with what, why, when, and how to do CPR. Okay, so take good notes. Okay. Now, first off, we always ask for questions because we want to make sure everybody learned everything they needed to know for their specific job. So does anybody have any questions about what was dealt with on the video at all?
Yeah, I do.
Yeah.
I don't have a question. It's just that I just didn't like the part where he had to stick the person.
With
the pen. Yeah, I forgot what the pen is called, but I know. You know, I ain't the one. I can't do it. They gotta stick yourself. I'm gonna look.
Well, you know,
you ain't got one, do you?
Yeah, it's one.
Oh,
sorry.
Let me ask this question: if you are a squeamish, you know, like she is, and so am I to a degree, when it comes to someone who might need a pen, like, what do you do outside of, you know, getting help or dialing 911? I mean.
Well, if they can't do it themselves.
Well, the unique.
But they can't do it themselves. But I don't want to do it. I know I have to do it, but I don't want to do it.
So just go through, just do it.
Yeah.
I know, because it's like I'm sticking myself.
Get it done.
Well, the good thing about it is that, you know, it was made in such a way to where all of the things that could make you feel squeamish or anything like that is totally removed from you ever having to see any needles or anything like that. The thing is, you're never going to see a needle.
Okay, that's what
I had to administer this on my wife. You know, she had an allergic reaction.
Wow.
It swelled her tongue up, and she couldn't breathe. And what we had to do was go to the hospital and get one of these EpiPens and administer it to her. So
you don't see the needle though.
You don't see it. You don't see the needle. It's on the inside of this orange pin right here. You take this safety valve out. You find the meaty part of their thigh and you stick it in the thigh.
Oh, but you know it.
For 10 seconds,
you when you
pull it
hear
straight out and rub the area. What did you say?
Won't you hear you sticking them?
No. You'll never see it. It's on the inside.
You stop being a wimp and just do it.
It's gonna go through the clothing, right? And it can save their life.
Why do I know that?
Your adrenaline, just like you helped that person that was having, that
they said
stroke
he was dead.
or whatever, just like your
adrenaline
jump into action when you're in a sense of emergency, you're gonna react.
You'd be surprised.
You'd be surprised what you do when those crises appear.
Just in case
I ain't gonna run. I'm just
in
gonna
case you can't order nobody around,
that's what
you're gonna have to
You do it.
Right.
You will do it.
Right.
Okay,
I don't know. I'm just saying myself.
You're gonna
running
think like
and
one of your
handling
babies and you're gonna handle your business.
And that's one of the main topics we gotta deal with, right? So for the most part, everybody that comes to this class, they are expected to step up to do what they have to do. You know what I'm saying? Because just imagine, right? You send your child to the children's church, right? You know, church is going on over here. Now, the children's church is going on over here during the church. All the children, you know, they're having, you know, they're separate from the church and everything else going on with the grown-ups, Bible study, everything like that. And they come into an allergic reaction. Now, we sent somebody over there that was CPR certified. But now, there's somebody who's kind of getting squeamish and they kind of just don't feel comfortable doing it. A lot of these things dealing with the CPR is going to be uncomfortable. You know, when you do the CPR, you want to break somebody's ribs and everything like that. But you have to understand, you may have to hurt somebody to save their life. You know, you may have to do that.
But that's why you get permission first.
Right.
So you don't.
From adults especially.
Yeah.
But see,
children, they just give you consent.
But see, you saying get
this,
They
right?
can respond.
There's nothing in here.
No, nothing in there. It'll be all right.
get permission. But at that time that it happened, I didn't. Was it okay? Look, you hollering he dead. I'm looking at him now. He ain't dead yet.
He couldn't respond. You did. He couldn't respond, so you did.
Okay, so that brings us to the 5 fears of rescue. As you can see, Rochelle, you get a thing of that. The 5 fears of rescue.
Okay, let's write that down.
So these 5 fears are kind of dealing with, you know, the 5 things that kind of will kind of scare you away from doing CPR. We want to deal with these things, okay? So, like I said before, you send your child to the children's church. The person that's watching them is certified. The parents think that the person watching them is going to step up and do something if needed. They were certified. It could be children's church, but it could also be child care. You know, it could also be caregiving. It could be anything. But when you send your, children, or it could be your mom, dad, it could be whoever, when you send them into the person's care, you're expecting them to step up and do what they have to do. And that's where it comes up with all of this lawsuits and things like that. Now, you may not necessarily get a lawsuit, but you may lose your job. The 5 fears of rescue. Right, you may lose your job, right? Because it was required of you to get a CPR certification card to get this job. Now it's time to do CPR, and now you're not comfortable doing it. Maybe you should have chosen another job. You know what I mean? Yeah. Maybe you should be like doing accounting or something. Like, you know what I'm saying? I don't know. But dealing with the public, dealing with people, and caring for people, children, then you got to step up and do it. Especially children. So we're expecting you to know what to do, okay? So, but, there's 2 different categories that we're dealing with here, right? One category is CPR, okay? And if you see on the board right here, in all actuality, we do CPR when the person is dead. And we're going to get into this in a lecture. Brother Shay's going to cover that, and we'll deal with that in more detail in the future. But our whole objective is to prevent it from ever getting to this point by doing proper first aid, right? So our bread and butter is going to be the first aid. We don't want to get it to this point. For this class, our bread and butter is going to be first aid. So that's why we're dealing with CPR and first aid. So what we want to do right now is kind of do a quick review over things that we learned from the video in regards to first aid. For instance, let me give you an example. If the reason why this EpiPen is necessary is because these allergic reactions, they can, swell your tongue up.
Yeah, they can.
You won't be able to breathe.
Yeah.
Can you live without breathing? No. So once you stop breathing, then you can fall out, right? And then you'll be dead, right? Now, before it ever gets to that point, we're hoping that we can open that airway up by administering that EpiPen, right? That's first aid, right? There's another thing you can do is give Benadryl. Buy you some time, calling 911, get them to the hospital, There's a lot of different things you can do. That's first aid. When it gets to this point, our only option is CPR. Actually, anytime it gets to this point, CPR is on the table to be utilized, okay? Just keep that in mind. So let's take it from the top, and let's deal with the different first aid topics that were dealt with in the video, okay? What's the first one? I'll go over them. The first one was asthma. Okay.
Yeah, it sure was.
So I taught a class at a church close to your church, and right after I taught it, there was a little 10-year-old boy that died from an asthma attack.
What?
Not only that is that nobody knew CPR, but then again, on the flip side, I also heard another story where they called 911 while he was having an asthma attack. And the lady was like, I don't even know CPR. I don't know CPR.
Wow.
Well, you got to understand, if you're having an asthma attack, are we going to do CPR?
No, we're going to get the thing that they need.
When they die, when they pass out, the brain shuts off. That's when we do CPR. When they're having the asthma attack, we're going to help them with
inhaler.
Inhaler, right. The inhaler. you try to get the inhaler to open those
lungs up,
right?
Yeah.
You know, a lot of times we get real technical here at G Medical. You know, we started studying how it's the carbon dioxide, you know, how that release is what helps you to breathe in, and that's why the paper bag works, because it builds up the carbon dioxide and you can breathe that in, and it helps you to take another breath. But at the end of the day, the short answer, okay, we're just going to get the inhaler. But
that's it.
Even more so, they say an ounce of prevention is worth a pound of cure. We want to know who these people are who have asthma. We want to prevent
that's a true statement
that,
that trigger.
That trigger. What's the trigger? Was it the dust? Was it the change?
They were allergic to the different things. You know, you could be anything.
Allergy can trigger the asthma type. What is it? You want to keep them away from it. So we want to be preventative, okay? But at the same time, when you got somebody that's high risk like that, you got to know your plan of what you're going to do in case these people have an asthma attack. Am I going to call the radio or walkie-talkie to the school nurse? They're going to bring the inhaler? Do I have a first aid kit with an emergency inhaler in it?
Yeah,
you got to know your plan
that would be smart.
of what to do, and don't just be caught running like a chicken with our head cut off. When you get back to the children, if you're watching them, know who has an asthma attack.
Right, so you will have it on hand.
You know, because you know, me and Brother Chef, we go to the same church, and we be pulling any and everybody, you know, to come in this worship house, right? And then they could, you know, could have been just doing some drugs, you know, anything can happen. They could fall out, anything, and we gotta know CPR first aid in case we have to step up. So, you know, when we, you know, doing God's work, right? You know, we gotta be prepared, you know, to save a life in case we need to. Okay. So what's the next one? The next one was choking. Right. So anybody know what we do to somebody who's choking?
I got so much asthma. That's right. Choking food.
Abdominal thrust. Right. The Heimlich maneuver. Right.
Yeah.
So what we're gonna do with the abdominal thrust is pretty much, if it's a child, then like I said, they automatically give you consent. A child is anyone from ages to 1, just above the infants, to puberty, which is about 10 or 11. But when they're like an adult, you have to ask for consent. Okay. So the first step, they're probably going to present the universal choking sign like this. You're going to tap them on the shoulder. Are you choking? Are you choking? If they can't make any sound, you know they're choking. They look like they're about to explode, turning blue, you know they're choking. Okay, and ask them, can I help you? And they say, yeah, okay, well, get behind them. You're going to spread their legs, put one leg between their legs and get a firm foundation, one leg forward, another one back, right? In case they fall out on you. You're able to hold them and put them on the ground softly instead of just falling. Right? So one leg forward, take your fist, put it in the small tissue of the soft tissue of the stomach under the ribs, and you want to pull in a quick jerking motion up to try to get to these diaphragm muscles that makes the lungs come in and out, and hopefully thrust what's in the airway out. Okay, if you're not able to clear that airway, you're gonna have to lay them down when that brain shuts off and start doing CPR. But every time you go to give breaths, because we do 30 compressions and 2 breaths, you're going to try to do a finger sweep to get that food out that's blocking their airway.
Wow.
Okay, we'll get to that in a minute, because a lot of times we deal with this with children and infants a lot. So we're going to be going over this over and over and over. So we'll get to that in a moment. What about, what's next? What else did we say?
Allergic
we went
reaction.
over EpiPen, right?
Oh, that was that.
We went over that. But what about seizures?
A heart attack.
Yeah, let's deal with seizures right now. And then we'll deal with heart attack next. What about seizures?
Okay. On his side.
Right. See, a lot of these things.
But you gotta call the emergency.
Just little stuff, like somebody had a seizure on me, right? I could have been preventative. Don't drink, don't smoke, don't do this. But I didn't know, right? They probably should have gave him some water. If you're gonna be drinking alcohol and smoking, that stuff dehydrates you. Drink some water at least, right? So she was going off the tequila and I think the Casadores or whatever else it was, and smoking it up, and then all of a sudden just fall out.
Wow.
I called 911. She was bleeding from her nose, but I didn't even know what to do. Also, we had a student that was sitting right here in his chair. She didn't even need to do it for her job. She came in strictly because her son had CPR done on him, and they brought him back to life. And when you go through that, you know what happened, right?
Yeah.
So what happened was he had a seizure, choked on his tongue.
Wow.
And then they had to do CPR to bring him back, right? So just, like I said, it's little things you can do. Roll them on their side. That allows them to not choke on their tongue. You can put something under their head because they're going to convulse a little bit, right? And then they won't choke on the bodily fluids or anything like that. So it's just something so small, but if you do it, it can save their life, right? So that is a simple thing to do. Now, if you can, and you're dealing with somebody who has seizures a lot, like they're epileptic, you want to catch them before they fall out.
Right.
Because you know how it can be walking or doing whatever, and then all of a sudden, fall out, right? So you want to catch them before that happens, okay?
Yeah.
All right. So, what about, somebody said heart attack?
I said heart attacks.
Heart attack, right. So
asthmas don't work, but I'm gonna tell you. But asthmas don't work. You can take asthmas if you want to. To me, they don't work. But I guess they say take 2 aspirins. I've tried aspirins. Look, I know, but I take an aspirin every day because I'm old. I'm in my 50s, so regardless of, I know they don't work. I'm still taking aspirin. Right, I ain't gonna be crazy. But they told me to give 2 aspirins so you won't have a heart attack. When I had a stroke, you take aspirin. I'm like, I'm still having it. I done had it already.
Okay.
With my mom. So I'm trying to figure out what is the aspirin supposed to do. Even though
in the blood.
Aspirin.
Really?
Yes. It has
like this is an example of a stroke, right?
Right.
For the most part, we gotta understand what we're dealing with here. It kind of breaks me into this right here. So I'm probably gonna have to deal with this, Rochelle. I'll just do it today. So you gotta kind of have a little bit of a foundation in the whole CPR, how the body works, and then you'll better understand, what we're dealing with a stroke or whatever. See, the stroke, we call that brain damage. No matter if it's a mini stroke, whatever level, it's brain damage. Yeah. It damaged some part of your brain, and it sent the signal to, some part of your body to tell it to properly function, right? It could have been your motor skills, it could be your speech, it could be your memory, it could have been, whatever the case may be, right? Now, that's not saying it can't be rehabilitated, That's not saying that if we think fast, right? What's the acronym? Face, arms, speech, time. If we think fast, they get you to the hospital in the time. They can, give you a shot that can help thin the blood to, get in this area that's damaged. Right. But at the same time, the stroke itself, when we see these symptoms, it is technically brain damage. Now, it can be a mini stroke. It can be, at a small, like a low level. But no. It's not brain dead. It's not brain dead. It's brain damage, right? And we'll deal with that right now. See, look. Let's deal with this real quick. Let's deal with this, Shay. CPR, okay? And we want to give a good little story on the background on this, okay? What does it stand for? Anybody?
Cardiopulmonary resuscitation.
Resuscitation, right. Cardio, dealing with the cardiovascular system. Okay, we got a good little picture of that. Right? Let me see. Right here we go. The cardiovascular system consists of the heart that pumps the blood, right? But also those pathways, which we call arteries, veins, different things like that, right? So the function of the blood is to transport things around the body. All right? Okay. So right away, we already can tell, based off of looking at something like this, what's that? Y'all seen that before, right?
That's a plaque. It's a
the cholesterol is the buildup of plaque, right?
Right.
So if the blood is the transportation system to the body, how is it going to transport if it's all this traffic in this system, right? It's like a 405, right?
Okay.
There's too much traffic, you can't go nowhere, right?
Yeah.
So the cholesterol is a problem. We know that, but that's not the worst problem. The worst problem is actually the table salt.
Yeah.
What?
Yeah, table salt. Everybody knows. Everybody knows.
It's not about loving it.
Look.
It just don't love. After a certain age, it don't love you.
It happens a lot.
It makes your hands fatter, your feet fatter. You ain't gonna have a lot of salt.
That's the worst problem. But this cholesterol is a problem as well. Okay, so like let's think about it here. The blood is the transportation system to the body. Okay, so what does it transport? What do you think? What is it supposed to transport?
Blood.
Besides blood, though.
Messages.
Oxygen.
Oxygen, right. So as you can see on this picture right here, it brings us to the next letter, right? The P, which stands for pulmonary, which is talking about the lungs, right? The lungs are responsible for bringing oxygen into the body, mixing it with blood, and then releasing that carbon dioxide, and that's what makes it bring in more oxygen.
Okay, but see, right there you got to eliminate the waste, so I'm trying to figure if it's eliminate the waste.
The waste is the carbon dioxide.
Okay.
Let me write that down. CO2, right?
Right.
CO2, okay. So, that's the waste. But what we're trying to get at here is that the oxygen is what's needed all around the body, and that's the main function of what the blood transports. It transports oxygen. Okay, we know we can't live without oxygen, right? So every part of the body needs this oxygen, but in reference to this CPR and what we're dealing with, the main thing we're dealing with is the what?
Reviving the brain.
The brain, right. We're talking about the brain, okay? So when we resuscitate, we revive the brain, okay? So as you can see on this visual right here, the brain gets its oxygen from the blood,
That's right.
right?
Yeah.
But the oxygen is mixed with the blood and it gets pumped by the heart. Okay, so let's think about this here, okay? So you breathe in, it doesn't go to your brain, it goes to your lungs. Your lungs mix it with blood, right? Once it's mixed with blood, now the heart beats. Okay. It flows up these two arteries called carotid arteries, and then it goes to the brain. Okay, so if it can't get there, it's going to be brain damage, right? All the way up until it gets to brain dead. Okay? That's if it cuts off totally. Now it can partially cut off or it can totally cut off. That's the difference. Question?
So with the mini stroke, it's partially cut off.
Partially cut off, right. So as you can see on this visual right here, it's not the whole neck. It's not the lungs that's not bringing. Like when you're choking, there's no oxygen coming in at all. So there's no oxygen going in the whole brain. If you have a heart attack, there's no oxygen going to the brain at all. Why is that? Because your heart not beating. The only way the blood can get there is your heart beats. But if your lungs is able to bring in oxygen, right, and your heart is still beating, but some of that cholesterol that was blocking your arteries, right, got caught up in one part of the brain, or it could have been something from. It could have been from your foot. It could have been a little bit piece of fat. It could have been whatever, blood clot, whatever. It could block that little piece. It could have blocked that little artery. Just that part of the brain isn't getting oxygen. And when just that part doesn't get oxygen, that's the part that gets damaged. So you can be going through your daily life, everything's good, and then bam. Okay? You see these symptoms, you gotta get you to the hospital as soon as possible. Okay?
So why, when you're choking, it doesn't cause a stroke or a mini?
No, it does cause stroke, but they what it is that it's brain damage. They don't even use the term stroke at that point. When you're choking, there's no. Let me explain it like this. Look, when you choke, your heart is still beating, right? So your brain is still getting blood and oxygen. But you got about a minute to get that airway clear, and then it'll be back good again, right? Because what happens is that when you breathe in and create that oxygenated blood, it's all over your body. So when you choke, your lungs are unable to bring in oxygen, but your heart is totally fine. It'll actually, when it gets that message that you can't breathe, it's going to beat a little faster. So you're going to be good on oxygenated blood, but it's going to run out if you don't clear that airway and get some oxygen. So what happens is, once it gets the signal it's no more, it shuts off. And then, after about a couple minutes of no oxygenated blood, stroke. Or you use the term brain damage, whatever you want to use. Question?
I'm talking about stroke. You're saying brain damage. I'm stuck on that because as far as I know, me personally, I had a stroke. And I refuse to be brain dead. But me being in class and you're talking, you partially become brain your brain, half of your brain, because I had a serious stroke, becomes half dead. But I refused to, regardless of what the people that were seeing me were saying. I was like, whatever. So, but my brain don't seem damaged because I can, whatever.
Well,
it's not severe. It wasn't severe.
It wasn't severe.
You're lucky. You're
very
lucky.
Look,
Yeah.
so this is the thing. Yeah. If you had a stroke, you had a certain level of brain damage. Now it's all praise due to God that you recovered.
No.
But if a stroke, that's what it is. A stroke is brain damage due to lack of oxygenated blood to a certain part of the brain.
So my daddy was right when he sounds crazy.
She did have brain damage because she couldn't use her half of her body.
Oh, half of your body got numb?
Yeah.
Yeah, that
was the damage. That was the damage. That was the brain damage.
So what happened?
You couldn't tell yourself to move, could you?
Right.
You wasn't ready.
Well, I didn't want,
No.
So it's not brain dead.
Yeah.
And it's not the severe brain damage on the level of somebody who passed out and none of their brain was getting oxygen. It was just a certain part that wasn't getting oxygen. And obviously, did they call 911? You go to the hospital?
No, I'm stubborn. I wouldn't go. I trust God.
So it could have.
But just like he said, you could always.
So you could have, you could have probably got less, effects. If you got to the hospital, it may could have done something. But I understand. You take some aspirin.
I take aspirins every day.
Yeah, if you were to have a stroke, take about 4 of them.
You could have a stroke.
Yeah, well, if you have a stroke, take about 4 of them. Well, it depends on what type of stroke. But this is the thing, right? Just think, what does the aspirin do?
That's what I was
saying. It thins the blood. It thins the blood.
To make it flow.
So if you having a stroke, something similar to this, take about 4 of them, 5 of them, whatever you gotta do to get that blood through.
You want to quickly,
one ain't helping me, so you telling me to take more than one?
No. I'm telling you.
That's not what
Look. Do everything you normally been doing. But what I was saying is, like, if I was coming to help you in an emergency and I know you just had a stroke, I might give you about 4 of those aspirins. But this is the thing where I don't want to teach you the wrong thing because you never know. It could be not a stroke.
Right.
It could be a aneurysm. You know what I mean? And if it was that, then that aspirin will be bad. It'll work in reverse because now it's making the problem worse. Now the blood's gonna be running out faster because it's almost like internal bleeding in the brain.
Inside.
Right. So the moral of the story is, in that case, the aspirin, what it does, it thins the blood.
Okay.
Because what's happening is that there's a blockage. Just like saying like this, right? Let's go back to this one.
Yeah.
This one, right? Cholesterol, the sodium. Like I said, I want to explain in very, very great detail about this sodium. But I have a video on the online training, which is why you all have cards. You can look at that. I broke it down, 20-minute video. It's a poison to the body. That table salt is really cyanide.
Wow.
Okay? So you look on the back and look them words up, big old words. If you look them up, one comes up to being cyanide. Right?
You tell me something.
So,
that's why
it hardens the muscle tissue.
Sea salt.
Sea salt.
I wonder why
sea salt.
they do that, 'cause I have both, but I
that's
love
sea
the
salt.
Kosher salt?
Kosher salt is good. So, but just stay away from that table salt. The restaurant one, and packaged food is gonna have it in it, so you gotta kind of stay away from it, right? So let me explain this. Look, right, blood can get very thick, especially for somebody who's what?
Overweight. I don't know.
What's the number one cause of death? Let's deal with this. I'm gonna put this in red. Right, heart disease. Number one cause of death.
Heart disease.
Cause of death. Heart disease. So the next question you gotta ask yourself: what's the ways that you get heart disease?
The way you eat.
Right.
Or
but it's two medical conditions. One is high blood pressure.
Hereditary.
And the next one a lot of people don't talk about, diabetes. So another problem with this salt is it helps you retain water. Everybody knows that, right? That's why they give you the water pill, right? When you get high blood pressure. But the diabetes, when you have diabetes, there's too much sugar in your blood, right? It makes your blood real thick and sooty, right? And your pancreas is supposed to thin it out with some insulin, right? But at this point in time, it's way too thick to get through here. That's why your heart will have to work harder to try to get the blood through, and you can have an attack and all these problems, okay? So
cholesterol don't go away.
Well, I know that. That's why my daddy's 75, praise God, and I kept him good out of cholesterol. That was one reason.
Cholesterol. Get some sunlight. You know, sunlight helps with cholesterol. You know, working out and everything. But sunlight is good. It turns actually cholesterol into vitamin D.
Really?
Right? Yeah, get some sunlight. You gotta get out, go get some sun, go to the beach.
Go
downtown Los Angeles.
Sunlight do what?
What
do sunlight do?
It turns in cholesterol into vitamin D.
Okay.
And a lot of people need that, right?
Yeah, you just took my shopping money, so.
No, it's just free, you know. You ain't got to worry about that sun. It's
so
free.
I can get that sun. I don't want to get that.
But I wanted to know that.
You got to do is go outside, get you a little walk, and then you know, get your vitamin D on. You should get like at least like an hour a day. You know, drink a lot of water. And get a lot of sun, right? You know, eat a lot of fruits and vegetables. You know what to do, right? You know, do some walking. You know. Okay. So
when I leave here, I'm gonna give you some chicken.
Cornbread?
Yeah.
That's where that cholesterol comes from. You know where it comes from?
Fried chicken.
Fried chicken, right?
Gotta give it up.
I leave. I take the skin off.
Yeah, I love some chicken.
That's why I love the skin.
That's it.
I'm sorry. I got it messed up, messing with. When I go to y'all remember that spot right there on Manchester Wings and Pot?
I can't
take that skin off. But at the same time, you gotta have portion size control, right?
Yeah, that's it.
Balance it out. If you gonna eat some chicken, then you gotta go eat an apple.
Get an apple, no chicken.
You know what I'm saying?
I'm being good. Taking
I'm trying to be
good.
some of the skin off.
Okay, so let's kind of make sure we understand this, right? CPR, cardiopulmonary resuscitation. The cardiovascular is not just the heart, it's the blood, it's the arteries, the veins, it's the system, right? Pulmonary, talking about bringing in oxygen in, mixing with blood, okay? All right, resuscitation, we're reviving the brain by putting oxygenated blood in the brain, okay? So when we press on the heart, we flowing blood to the brain, okay? Because we're trying to revive it, right? It's just like, let me see. We pressing on this chest, squeezing blood out of this heart to flow it up through these arteries to the brain. The oxygenated blood is about here. We got to get it here to get the brain back on. Okay.
Keep the brain clean. Yeah.
Now, if we don't do CPR, we have approximately 10 minutes until they go brain dead.
Okay.
And it's going to be an increasing level of brain damage until they get to that point. Okay? Let's keep that in mind. All right. Now, if we do CPR, it can be up to 45 minutes. They can come back. They can go back again. You know, it's just like the movies where you're dealing with that flat line. That's a flat line. I mean, they did. Now we can do CPR. But then when they do the CPR, you start to see that little telemetry line going up and down. That's the heartbeat. Okay. So we need to get that thing back going. But at the same time, what's happening is if we don't do anything within 10 minutes, that brain damage is going to be so severe, it'll be brain dead. There's no life without that. Okay? So this is pretty much how you die every time you die. Brain dead. Okay? This is what we're trying to prevent. Right? A lot of times this CPR is to be done in conjunction with the 911 call. Right? When they arrive, if they already brain dead, there's nothing they can do. See, you may not know all the tricks to the trade of how to, tweak this body to get it back alive, but, the 911 does. So you're trying to get them there with them not being brain dead, okay? And like I was sharing with the class, after about 10 minutes with no CPR, after the brain shuts off, because it didn't get this oxygenated blood, it's going to go brain dead, and it's going to be an increasing level of brain damage, okay? After about 5 minutes, that brain damage is severe, okay? So, that brings us to our baby, right? You know, because like I brought up the 5 fears, a lot of them are dealing with us not knowing when to do CPR. Because, you know, like the lawsuit, you know, you can be scared, you feel like you hurting somebody. Now, if you're dead, meaning you need CPR, can you get killed now? No, you already did. There's nothing that can kill you.
The 5 breathing or the 4?
Oh yeah. No, it's cool. I'll bring it up.
Okay.
So, So number 2, if you're dead, I can't hurt or kill you, right? So you're already dead, right? So with that being said, you know, we need to deal with these 3 things. Okay. First off, it's going to be unresponsive, no breathing, no pulse. This is how you determine if somebody's dead or not, right? So if somebody's lying on the ground and I tap them and I try to see if they're alive, there's no response. Then I check their breathing. I don't feel anything coming out. And then I check their pulse and there's nothing. What can we conclude about this person? They did. Now we can do CPR.
Right.
So a lot of people, they get in this mind, oh, once you see it, oh, they gone, man. And then we can do now. It's too late. No, this is when it starts. This is the time they get down with it. You know what I mean? Don't do it before. You know, they're not there yet. But now, no breathing. Okay, now we can do CPR. Okay. So also let's keep in mind that you know, you have to make sure you check all 3 of these things because they could not be dead. You know, it could be just like some blunt force trauma to the head. It could have been a diabetic coma or diabetic shock. You got a question?
In the video, they said to see if they're breathing or if they're gasping. So if they are like gasping, would you just wait for them to stop breathing?
No. See, for the first 2, that's a good question. It's a more advanced question, but you know what I'm saying. For the first 2 minutes, right? You know, if nothing happened to your lungs, right, but your heart stopped, it's gonna be like that muscle memory thing. Like you ever see a chicken with its head cut off?
Yeah.
Right? And it still keep running. Yeah. The head is gone,
but he's gone.
But he's still running around. It's like a muscle memory thing. So what's happening is your lungs is still trying to get air. It looks like gasping. You know what I mean? For the first 2 minutes. But no, it's not normal breathing. Okay? It's the same thing in reverse. The heart is still gonna try to beat if you choke. But it's going to slowly stop. It's not going to just totally stop. You're not having a heart attack. It'll slowly stop once it stops getting that signal from the brain. So we are not doctors and surgeons and things like that. So we just do CPR. You know, so we can't make the determination if it's going on or not. Just do CPR. Now there is like little small things where I want you to really get an understanding is. Just keep in mind this, right? If your heart is beating, we don't have to do compressions.
Right. Okay.
But at the same time, if your heart is not beating and you're not breathing, if we don't get that brain back on soon, it's going to stop as well. So there are certain situations, like maybe you get a child out of the pool really quickly after they just drowned. Their heart still might be beating fast and everything. And if that's the case, all you have to do is something called rescue breathing. Just put oxygen in. Because when you put that oxygen into those lungs, the heart is going to beat it up to the brain. And it can come back on. But once that heart stops, now we got to go with that CPR. Okay? And the rule of thumb is 60 beats or more. Okay? So, and that's just meaning faster than a second. It's pumping pretty fast. Okay, well, you feel a pulse, right? And it's pumping pretty fast. Okay, you don't have to do compressions right now. But if you do breaths only and they come back and their brain comes back on, okay, that's fine. But if not, then we need to do all-out CPR, compressions and breaths. Okay? All right. Now we're going to deal with why we do CPR, okay? Why? We do CPR to deliver oxygenated blood to the brain to prevent brain death until the 911 ambulance arrives, okay? So our whole objective is we're trying to put oxygenated blood in this brain, right? Trying to fill this up all the way up to the top, right? What while the ambulance is on its way. You know what I mean? And when they get there, they can save the day. Maybe they may come alive. You know, you might, or they come alive. Let's add that. Or they alive. That can happen as well. Okay, and if that happens, then you will stop CPR. Okay. Okay. Now, last but not least, let's deal with how we do CPR. Okay. Any questions about what, when, or why? You got that? Okay, let's deal with how, okay? So look, you're gonna, your whole objective is to compress on the heart, flow blood up to the brain, fill the brain up with oxygenated blood. So you're pressing on the heart, flowing the blood up, you're putting oxygen into the lungs to fill the lungs up with oxygen so you can then compress that oxygen and blood up to the brain, okay? So just understand that objective, right? It may not look like it's working, but it's working. Okay,
and the 2 breaths are because
the 2 breaths is to put the oxygen into the body.
So
when the brain cuts off, everything cuts off.
Right.
So the lungs are unable to bring in oxygen, and the heart's not going to beat anymore.
Do we do the 60 or the 30?
30. We do 30. Okay. So you take the base of your palm and the center of the chest. Now look at this right
here. Look.
Bam. The heart is right there in the middle of the lungs. You know where your lungs are, right? So your heart is in the middle. You know, don't get the misconception it's over here, right here with heart. No, heart is right there in the middle. It's a little bit more than the right to the left, but it's right there in the middle for the most part, right here.
Wow.
So when I do CPR, I put it right there, right? Take the base of my palm, lock my elbows out, and what my objective is to put my weight on them and raise up. Weight on them, raise up. Okay, I'm not doing push-ups on them. Right, I'm leaning down and I'm doing 30, okay? And I need to do them at a speed of 2 compressions per second, right? So I'm gonna watch that clock. By the time 15 seconds go by, I need to see 30 compressions, right? And I need to count out loud. After doing about 30, we're gonna stop. We're gonna do a head tilt chin lift, and we're gonna do 2 breaths. Let me get my mouth here, right? Show you real quick. I guess we gotta
right there?
Huh?
You say, I thought that's what you want, the green one.
Okay, it's cool. I'll use this one. I normally want to use my Red Cross one. Okay, I'll use this one. Okay. You're going to do a head tilt chin lift, open the airway. 2 breaths, right? And you're going to continue. Notice I watched for chest rise, right? And you're going to continue all the way until the ambulance comes. 30 and 2, okay? Head tilt chin lift, 1, 2. Okay, and just keep on doing that all until the ambulance comes. Now, if it's more than 1 person, after 5 sets, you're going to switch every 5 sets or 2 minutes. Okay, make sure they're on a firm, flat surface, the floor. Okay, all right, something hard under it because you have to compress between the heart and the heart and the back.
That again? If it's 2.
Okay, if you have help, like something happened to me, right? You know, so you would do 5 sets, which is equivalent to 2 minutes, right? 5 sets equals 2 minutes. CPR.
Switch up.
Yeah, and you'll do 2 minutes, you'll do 2 minutes, you'll do 2 minutes, you'll do 2 minutes, you'll do 2 minutes. That way everybody stay fresh.
So when you're doing CPR for the first time, you're not gonna give oxygen first. You're gonna do the chest first.
Yeah, right now at this point we're gonna do the chest first. Now, a lot of times that ABC, you ever heard of that ABC back in the day? We used to do that for the emergency preparation. We took this class, the CERTS, Community Emergency Response Team. A lot of times you just want to reposition the airway to make sure they're not choking on their tongue. But if that's not the case, then you just move into the CPR, especially if you know what's going on. Okay. But let me give you this quick disclaimer, right? Number 1, if they've been dead for a long time, you can see that the body's cold and stiff and all that. Don't do CPR. You ain't got to do it on it. Right? If it's been more than an hour, don't do CPR. It ain't going to come back, right? If you don't know and it looked like it could have just happened, all you can do is CPR. You can't say, oh no, just assume that they ain't going to make it, right? Because I've heard stories. There's been probably hundreds of students taking this class, done CPR, Some stayed, some didn't.
Yeah.
You know, but they did what they had to do, right? So you don't know, you may not know if they're gonna come back or not, or how long it's been. Just do CPR in conjunction with calling 911, and when they show up, they're gonna take it over from there. Okay. Now, if it's been recent, okay, you gotta really do your thing.
Yeah.
This is a chance you got, okay? And every time the ambulance showed up, they said 8 out of 10 times, nobody's doing CPR, the person died, whatever the case may be. So if you actually have the opportunity to save somebody, then you should step up. Also, if you don't do CPR, we'll never know if CPR would have worked or not if that 10 minutes passes.
Right.
So at least give them a shot to come back. You know what I'm saying? So pretty much what we're trying to say is, let's give these people an opportunity to bring them back to life by doing CPR. Hopefully we can prevent it from ever getting to that point by doing first aid. Okay. Any questions about that so far? Okay. So we're gonna move on to the skills portion of the class. Okay. And I'm gonna play the video for the CPR. We're gonna take a quick 5-minute break to get set up. Go ahead and clear off your desk, and then we'll be right with you in just a moment. Okay. Thanks a lot.